Hello guys, I hope you're well. So we went through a question earlier about carbimazole, and a very crucial point I wanted to talk about is neutropenia and agranulocytosis. Now, generally in the exam, anytime you see a medication that has sore throat or infectious symptoms or signs, generally that would be a referral to a GP or even A&E, depending on the medication. So generally, with DMARDs, so disease-modifying anti-rheumatoid drugs like methotrexate or even sulfasalazine, but sulfasalazine is an aminosalicylate as well, so you have to look out for blood dyscrasia symptoms. You would essentially refer. Anyway, so let's see what the BNF says. Forget about what I'm saying. Manufacturer advises of the importance of recognizing bone marrow suppression. So bone marrow suppression obviously is linked to white blood cells, so the infectious system in the body, and recognizing bone marrow suppression induced by carbimazole and the need to stop treatment promptly. So this is a very crucial point. Patients should be asked to report symptoms and signs suggestive of infection. So sore throat. So in totality, when you're looking at carbimazole, any sore throat, you need to report the symptoms. By reporting, it doesn't mean call 999 or call the police. They're referring to a healthcare professional. So this is a very, very important point. So a white blood cell count should be performed if there is any clinical evidence of infection, and carbimazole should be stopped promptly if there is clinical or laboratory evidence of neutropenia. So that is essentially telling you that in the exam, if they give you a table which has blood lab results 6 months ago and today's current results, any decrease in sort of white blood cell count, which could be a sign of neutropenia or a infectious reaction, so a reaction of the body to an infection, that would mean it's a neutropenia. That's a very, very important point. Now, to evidence our congenital malformations assumption is here. So carbimazole is increased risk of congenital malformations, and there is advice in regards to contraception. But my important point I wanted you guys to emphasize on is carbimazole is associated with increased risk of congenital malformations when used during pregnancy, especially in the first trimester and at high doses. So a high dose is classified as a daily dose of 15 milligrams or more. So keep that in mind. So carbimazole is associated with an increased risk of congenital malformations. Now, any medication that has antifolate activity, examples would be methotrexate, trimethoprim, phenytoin. These medications will cause congenital malformations as well. Now, why? Because you need sufficient folic acid synthesis in the fetus to have cartilage and bone formation. And as far as I'm aware, correct me if I'm wrong, within the first trimester, this is the most important time when cartilage and bone formation are important. And obviously, vitamin K plays a part in that too. That's why warfarin is embryopathogenic as well. And thank you so much, guys. Let me keep this video